It's a warm summer morning in Rosedale, Maryland. And at the Eagle Walk Apartments, the day is just starting for Sarah Riley.
Good morning.
Hey, good morning.
Jamal, a care assistant, is arriving for the day.
You hear laughing?
Yeah.
He's up already.
Brandon Alsup may still be in bed, but he's ready to get going.
You ready to roll?
Brandon's mother, Sarah, relies on Jamal's help in order to care for her son.
Jamal normally comes over in the morning. He's a care aide through Angel's Healthcare. And then what we'll do, we get him in the morning, he'll just take the wedge out.
Both Sarah and Jamal then undo Brandon's bed.
That's my boy. How are you doing? How are you today? You good. We'll roll him over on the side. Jamal gets the bottom part. And then I'll get the top. And then we'll get him changed.
At 19 years old, Brandon is still in diapers.
Normally we go with 2 diapers because he takes Miralax as well. And you never know when he's going to have to go to the bathroom because he's unable to communicate with me when he has to go to the bathroom.
It takes both Sarah and Jamal to change Brandon's diaper. And then it's time to get Brandon into his wheelchair.
Because there's no lift or anything like that to get him in the chair. So he has to be manually lifted by 2 people because he has osteoporosis. And you want to always try to protect his bones. So we're going to just slide him down right to the edge. Good. Now we'll go from there to the chair. Good job, bud. I know.
Once Brandon is comfortable in his chair, Jamal and Sarah hook straps across Brandon's chest and his waist. Brandon's mother then puts on his footrests, and then a pillow is placed underneath his feet.
Let's get the music back on. One of Brandon's favorite things to do is listen to music every day. Music generally has to be playing from the time he gets up in the morning till the time he goes to bed.
Sarah then puts a tray onto the wheelchair and prepares to give Brandon his nebulizer treatment.
And then just turn it on. And then Jamal will just hold this.
As you can see, Brandon enjoys the treatment, which lasts for about 2 minutes. Sarah then wets down a towel to wash Brandon's face.
I have to wash his face. He's not able to use his arms or his legs. He's unable to do anything. He is completely dependent on me and Jamal for his AM care.
This includes brushing Brandon's teeth.
When brushing Brandon's teeth, the care assistant Jamal, he has a portable canister, and attached to it is a yanker that I use to get any excess toothpaste or water out of his mouth, or any type of saliva. If I didn't do that, he would choke and gag on it.
Once Brandon's teeth are brushed, Sarah and Jamal wheel Brandon into the living room. And while Jamal hangs out with Brandon, Sarah gets Brandon's medication prepared in the kitchen.
First thing he gets is GI medicine. That's for acid reflux. That's the Prevacid 15 milligram solute tabs. He takes those twice a day. This is his diazepam, which is Valium, that he takes for his tone. Was being spastic, so I have to crush his pills because he's unable to eat pills or chew. I'll mix the pills with a little bit of applesauce. I'll get a syringe and then we'll put some water in here for the solute tabs.
Before Brandon takes his medicine, his mom gets him prepared.
He doesn't have any lip closure with eating, so sometimes I have to do a little bit of oral stimulation.
Sarah feeds Brandon his medication and he laughs. Yet Brandon still needs help swallowing.
While he's eating, just to get him to swallow, you have to put my finger inside of his mouth and make a little C back and forth, and then that gets you to swallow.
Brandon also needs help swallowing his Prevacid. Even though the tablets are dissolved in water, his mother has to help get them down.
As he doesn't have a lot of muscle strength in his mouth, so he's not able to eat and chew and swallow like a normal person would. That's good.
And because of this, Sarah has to make Brandon special food.
For breakfast, he'll have Boost in the morning.
Along with his Boost, Sarah has to prepare more medication.
This is the Keppra. It's for seizures. He takes it twice a day, in the morning and the evening.
Also on the menu are boiled potatoes. Once they're done, Sarah purees them.
Put them through a ricer first.
Sarah then strains cream of chicken soup onto the potatoes.
I have to try to get as many calories in him as I can. That's why I added extra butters, cream, sugars, cheese. Brandon's being so spastic and that tone kicks in. He burns a lot of calories in a day because of his body motions and movements.
The potato soup mixture then has to go through another strainer but before it's ready for Brandon to eat.
Just to double proof to make sure there's no lumps or chunks in it because he will not tolerate it in it, and I don't want him to gag or anything like that.
It's finally breakfast time. Brandon's mom puts a bib on him.
What are you doing?
And then she feeds him with a spoon.
Hey, buddy.
As Brandon eats, you can see he's enjoying his food.
Hi, it's my boy.
Because Brandon swallows very slowly, it takes about an hour for him to eat as well as drink through a syringe.
As far as liquids, I have to use a syringe because he doesn't have any lip closure.
After breakfast, Jamal brings out a mat so Brandon can do his stretches.
Both of us have to take Brandon from his wheelchair to the floor because Brandon is always a two-person transfer.
Both Sarah and Jamal have to be on the mat to monitor Brandon.
While I'm doing the range of motion at one end, Jamal will be monitoring his head because with his tone, he'll push and he'll slide off the mat. So we have to make sure that he's protected at all times.
Sarah starts by stretching Brandon's legs, feet, and ankles.
You want to keep him as loose as you possibly can. So I'll do this in the morning and then the evening, and then I do the stretches at night.
Because Brandon's entire body is rigid, Sarah also stretches out his upper body, including both of his arms.
Of course, his arms always tight, so I'll just go down as far as he'll let me go.
Sarah and Jamal then turn the mat around so Sarah can do special stretches with Brandon's hands.
Just lay him like this, then I'll stretch his hand, his wrist.
Brandon also has special braces that Sarah puts on him to better stretch his hands.
I'll put his hand braces on. That just gives him a little bit more flexibility to open his hands up wider.
After finishing the stretches, Jamal and Sarah get Brandon back into his wheelchair.
Good job.
Brandon is excited because his father, Reginald Alsup, has just arrived.
I'm his barber too, so I come over here maybe he gets a haircut maybe every 3 weeks.
And while Reginald doesn't live with Sarah and Brandon, he helps as much as he can to care for his son.
It's pretty tough. I just do everything that I can do outside of work.
Including coming over to give Brandon a haircut.
Because you can't send him to a normal barber. I don't know of any that would really handle him and the way he moves, his head control and his muscle tone. You have to really know what you're doing.
Reginald has been cutting Brandon's hair since he was a young child. He enjoys spending time with his son, and Brandon seems to like it too.
We talk and play, laugh. Yeah, that's our bonding time when I cut his hair.
And now that Brandon is older, Reginald also clips Brandon's facial hair as well.
Oh, see, you have to be careful because he jerks his head a lot.
After Brandon's haircut, Sarah takes Brandon into the bathroom to get his hair washed.
And it's kind of tight, as you can see.
Sarah then gets a towel and wraps it around Brandon's neck because she has to wash Brandon's hair while he's in his wheelchair.
This is basically just to get all that excess hair.
It's now bath time, but Brandon cannot take a regular bath.
Brandon has to get a bed bath, a sponge bath.
To do this, Sarah has to move Brandon out of the bathroom and into his bedroom, which is tough because the wheelchair barely fits through the doorways.
Yeah, it's just tight. And you have to hold his arms because they'll get caught jammed up in the door.
Brandon has to be in his bed for the bath, and his father watches him, while Sarah brings a bucket of water into his room and lays out towels on the bed.
I'll roll him over from here to here to do his bath.
From there, Sarah begins washing.
Just have to wash him off. Hi, buddy. Yeah. His knees aren't able to bend, so therefore he can't fit inside of a traditional bathtub. And that's all I have here. So he has to get a sponge bath. With Brandon, you have to be very quick with when you're giving him a bath. He gets very, very cold quickly. So I try to move as fast as I can and try to keep him wrapped up nice and tight and snugly as I'm washing.
After his sponge bath, Sarah puts a diaper on Brandon and then has to dress him.
He's totally dependent for everything. He can't help me do anything.
Therefore, Sarah has to put on Brandon's pants as well as his shirt.
His arms are really contracted, so just putting his arm through a shirt is extremely difficult. His tone is kicking in, so it makes it so much harder to try to move him around.
And what makes this even more difficult for Sarah is knowing that life didn't have to be this way for Brandon. It was September 13th, 1998. Sarah Riley was pregnant with Brandon. On that day, Sarah's water broke and she was admitted into Greater Baltimore Medical Center.
I was being treated by a resident doctor because my physician hadn't arrived there yet.
According to pediatric neurologist Michael Katz, MD, there was a report of abnormal fetal heart tracing on Brandon's fetal heart rate monitor.
I was told to lie on my left side because the baby wasn't getting enough oxygen.
Sarah's treating physician finally arrived and called for a C-section to get Brandon out. At 3:36 p.m., Brandon Aaron Alsup was born. In the delivery room, Brandon was noted to be floppy with poor respiratory effort.
We kind of rushed him out of there. Pretty much the beginning of it all.
The first time I really got to see him, he was on a machine, and he was on a machine for 2 weeks, and he was in the hospital for 31 days.
About 2 months after Brandon was born, he was evaluated by neurologist Rebecca Ickard, MD. The report indicated that Brandon was a 10-week-old with a history of perinatal hypoxic ischemia encephalopathy. Pediatric neurologist Michael Katz says Brandon suffered a lack of oxygen to his brain, and it happened around the time of birth.
My whole life had changed at that moment.
Everything just got really hard. I didn't know that it was going to be that bad.
My son was never going to be the same. He would never live a more healthy life.
The long-term consequences of Brandon's brain injury include profound global delays in all areas of development.
He functions at cognitive level, 8-month to a 12-month-old level.
Brandon can neither walk nor talk, and he is dependent for all activities of daily living, far beyond what would be anticipated for a child of his age.
It's been extremely hard. With him being 19 years old, and I have to take care of him as if he still is a toddler.
Brandon also has spastic quadriplegic cerebral palsy, which is the loss of the use of the whole body.
He has no upper body control whatsoever. He has no head support, and with him just being contracted and with his lower extremities, he has no support there as well.
Cerebral palsy is a lifelong condition, and individuals such as Brandon require specialized therapeutic and adaptive equipment to support their care needs throughout the day. Life Care Planner Nancy Bond outlines these needs in Brandon's Life Care Plan. The Life Care Plan provides for a manual wheelchair, a bath chair, a hospital bed, and a patient lift, as well as other positioning and mobility equipment for Brandon.
With that tone, he's so stiff, and it's harder to move him around.
Brandon's movements are all influenced by the spasticity of his muscles.
See you shaking?
In fact, Brandon is so spastic that he literally dislocated both of his hips. This is what he looked like before surgery. And after surgery, you can see how doctors used rods and screws to repair the damage.
It was very hard, him having to have the surgery, and then after the surgery, it was very, very hard because he was in excruciating pain.
Brandon also had bilateral adductor release surgery, as well as hamstring release surgery on both of his legs.
Afterwards, he was not able to bend his knees anymore.
Because Brandon cannot bend his knees, he no longer can sit comfortably in a vehicle.
Try to bring him and dip his legs down as much as you can and position him back. Once we get him into the car seat, you can get him strapped in. But because his knees doesn't bend, his legs go right up beside the driver.
Which is why the Life Care Plan provides Brandon with adaptations to make a vehicle wheelchair accessible.
Every day is a struggle, physically, mentally.
Brandon also has scoliosis, as well as a history of osteoporosis and seizures, which makes it even more challenging to care for Brandon.
Daddy!
Brandon's communication is also very limited.
He'll normally say, hey, hi, good, daddy, of course, throughout anything that he's excited about.
Brandon especially gets excited when his grandmother comes to visit.
What you doing?
They have their own way of communicating.
Hey, old buddy.
And she'll talk to him, and then he'll talk.
Old pigs.
They just go back and forth like a conversation.
Now get in here, Reggie. Brandon waiting on you. Yeah.
While Brandon is able to say a few words, he is not able to effectively communicate his needs or wants.
It's always a guessing game.
According to Dr. Katz, Brandon requires speech therapy, and because Brandon also has severe vision impairments, Dr. Katz also notes that Brandon would benefit from a special education teacher as well as services for the blind.
Okay, buddy.
Sarah is Brandon's primary caregiver, and it's become more and more difficult as Brandon gets older.
He weighs 85 pounds, and I'm not so big myself.
Sarah typically gets Brandon ready for bed all by herself.
Unfortunately, I only have a care assistant during the day. So in evenings and weekends, I'm alone. I love you. Night, Brandon.
A few hours later, Sarah has to check Brandon's diaper.
And I definitely don't get sleep at night because I have to check on him every 2 hours, monitor him.
Sarah's whole life has been turned upside down. And so she just stopped work completely and dedicated her whole life to Brandon.
And it make my back hurt. Woo, it's tough.
And this has affected Sarah's health as well.
I have been affected as far as I have carpal tunnel. Sometimes my back goes out on me. So you have to just, I lift properly, but that still doesn't matter because I'm lifting someone almost my size and I am a woman.
She works 24/7.
Because Brandon's injuries are permanent and not anticipated to improve, he will continue to require total assistance with all activities of daily living and constant supervision lifelong. All of this is outlined in Brandon's life care plan, including providing Brandon with a lifetime of medications and supplies, as well as providing caregivers for Brandon based on his needs. Dr. Katz endorses this plan and also notes that Brandon requires a 24-hour-a-day nurse. Reginald, Brandon's father, is also involved in Brandon's care and visits daily.
Every morning before I go to work, I'll stop past and make sure everything's okay, that she doesn't need anything on my lunch break sometimes.
Reginald also helps Sarah get Brandon out of the house.
Hey, Freddie, you gonna go for a stroll?
Which takes two people because Brandon has to be taken out of his wheelchair. Sarah then watches Brandon, while Reginald takes the wheelchair up a flight of stairs
That's very heavy.
right outside Sarah's apartment.
You have to come back and get him together. It's very hard with the tone to get him up the stairs. The living conditions are bad. It's not suitable for Brandon.
Which is why the Life Care Plan provides for Brandon and his mother with wheelchair-accessible housing.
Hey, buddy. Brando.
Once outside in his wheelchair, you can see Brandon is happy.
Oh, he smiles all day long.
It makes me happy, and it's still hurtful. It's like a mixed emotion. I'm happy because he's happy that he can enjoy these things, but then I'm still hurt that I know that he can't enjoy these other things.
Because life didn't have to be this way for Brandon.
I hurt so badly for my son because things could have been differently.
I'll never get over it. It's been 19 years and I'll never get over it. That's my son. It's very hard.
It's 19 years later, and I still feel like I'm at September the 13th, 1998. It's like I have to relive that same moment every single day of my life.